So in Ontario, our numbers have gone up to 3,100 by 3,128 between yesterday and the previous day. The average is around 3,000 now for the last week, and so we've kind of leveled at the 3,000, which is it's a leveling, but it's still at a high level, and we're seeing most of that being pushed by Toronto, GTA area. Until Ottawa is actually starting to go up again. They were in the sort of low double digits now. Today's numbers were 126. Donc au niveau de Ontario, on a augmenté des cas de 3128 depuis le jour précédent, et nous avons constaté que dans les derniers 7 jours, la moyenne d'augmentation quotidienne est à peu près 3000 à peu près. Donc, on a stabilisé là, à 3000, mais quand même, c'est un chiffre très haut. Et aussi, comme toujours, c'est la région de Toronto qui a la plupart des cas. Toronto, Peel, York, Durham, etc. Ottawa commence à augmenter. Il y a quelques semaines, on avait comme une trentaine de cas, vingtaine de cas. Là, on est rendu à 126 cas à Ottawa. Donc, c'est une chose à surveiller. Il faut dire aussi que si on voit au niveau de la situation provinciale, on constate qu'il y a beaucoup de bureaux de santé qui sont... La plupart, en effet, tous les bureaux de santé sont presque dans zone rouge, et on a pas mal de bureaux de santé, incluant la nôtre, qui est plus dans le rouge, qui vraiment approche le gris. It's notable to say that we're seeing an increase across the board in Ontario. If you look at the trends of the numbers, the average sort of health unit now number in terms of 7-day rolling average is really right at the red zone, right there. We are clearly above the red zone into the gray, and there's multiple health units outside of Toronto and GTA, for example, Muskoka, London, Windsor, that are quite high in terms of those numbers and continuing to grow. We're also noting that this is happening in Quebec, and it's happening across Canada, and it's happening across the world, where they're having some more severe lockdowns in certain territories, including Quebec, that apparently is forthcoming. So in terms of our numbers, again, our numbers have gone up, and I just want to share those with you at this point. So we are now at 489 active cases, which is a lot of cases, and we're up to 1,730. And I want to break down a bit the numbers for you, because we've had a break in sort of the reporting. Basically, and I want to put a caveat there that our numbers will likely be adjusted by about 50. There was some doubling of numbers yesterday. We're going to correct that, but I just want to show you right now where we were. We're showing the change now that we've added 41 cases from the previous day. So we've added 15 in Prescott-Russell, 13 in SDNG, and 13 in Cornwall. And if you look at what we added yesterday, we added a total of 255 cases, but that's from the 31st to the 4th. And that's so it's over a 3-day period. And from the 255, we added 83 in Cornwall, 10 in Akwesasne, 102 in Prescott-Russell, 60 in SDNG, for a total of 255. Again, that number will probably reduce by 50 because there is some duplication of reports. So, but again, it's the 200 range, which is a lot for us. Donc, au niveau des chiffres, je vais juste vous donner un sommaire ici. Actuellement, nous avons 489 cas actifs dans notre région, pour un total de 1730. Nous n'avons aucun soin intensif, 7 hospitalisés, 1 décès, une qui était supplémentaire, une qui était enregistrée d'une maison de longue durée à Akwesasne. The extra death that we've added here is from Akwesasne, one home. Retirement, long-term care home that's an outbreak tragically. Donc là, on a ajouté, aujourd'hui, nous avons ajouté, je vais juste vous mentionner ici, on a ajouté 41 cas, 15 à Prescott-Russell, 13 à SDNG, 13 à Cornwall. Et hier, nous avons ajouté 255, mais c'est plutôt 200. On va le corriger d'ici demain parce qu'on pense qu'on a des duplications au niveau des rapports. Donc, quand même, on a plus que 200 cas ajoutés hier. Donc, dans les 255 qu'on a ajoutés hier, on était 83 à Cornwall, 10 à Akwesasne, 102 à Prescott-Russell, 60 à SDNG, donc pour 255 cas ajoutés. Comme j'ai dit, ça va être ajusté. Donc, il va y avoir peut-être 50 de moins quand on va faire la correction demain. Au niveau des flambées, on a 15 flambées actuellement. La plupart sont dans les maisons de longue durée. Je vais faire un petit sommaire tantôt. In terms of our outbreaks, we have 15 outbreaks right now. The majority really are in long-term care facilities, congregate living sectors. I will talk about them a bit later, give you a bit of an update on that. I just wanted to go over the map here. And again, just showing where we have the cases. We're actually up to 139 active cases in the Cornwall area. You can see that we have active cases practically in the whole area, in our whole area as well. Donc, vous pouvez voir qu'on a des cas actifs presque partout dans notre région. On a 139 actuellement à Cornwall. Donc, on a les cas actifs ici. Au niveau, je voudrais juste voir ici cette autre courbe ici. Ça, c'est la moyenne de 7 jours qu'on a sur 100 000. Donc, vous voyez, ça, c'est le chiffre qu'on utilise en effet pour voir dans quelle zone on va être. Et vous voyez, la zone rouge est là. Donc, clairement, on est dans zone rouge et vraiment dans zone gris ici. La moyenne, c'est l'orange ici. Donc, on a beaucoup de cas, mais on voit un peu que ça commence à diminuer ici, mais quand même, on voit clairement qu'on est dans zone rouge actuellement. So what I'm showing here in terms of the 7-day rolling average, you could see that we are clearly in the red zone here, going upwards and sort of stabilizing. So this is kind of a good sign here where we're kind of going downwards, and hopefully we'll see that. One of the things that people have been asking me really is, when we're looking at these numbers, like what did the lockdown do anything? And so these numbers really represent, in my opinion, what happened last week. Because it takes people go and get tested, we get the results a couple of days later. It's like over the weekend, the 200 bump that we had plus really reflects people tested middle of last week, which would have only been a couple of days after the implementation of that Boxing Day lockdown. So I do believe that perhaps we're seeing that slight stabilization. That is maybe a sign, but we won't know for sure what the effect of the lockdown was, and if there was an effect of people getting together in Christmas and New Year's moving forward. So that's something that we're going to be looking at and very closely moving forward. Donc, au niveau des cas qu'on voit, autrement dit, nous avons vu qu'on a eu beaucoup de cas le fin de semaine passé. En effet, on se demande toujours, est-ce qu'on voit l'effet encore des fermetures qu'on a faites le 26 décembre? En effet, c'est non. Je ne pense pas qu'on est rendu là encore parce que, en effet, la plupart des cas qu'on a rapportés hier, on avait testé la semaine passée, mercredi, quelques jours après qu'on avait fermé la plupart des affaires, etc. Donc, je pense qu'on doit continuer à voir. Là, on a vu tantôt, vous avez vu comme peut-être un plafonnement de notre courbe. Par contre, il faut avoir vraiment une bonne 2 semaines au moins de vraiment voir le trajectoire. Espérons que ça va plafonner. Et aussi, on va voir l'effet de Noël si les personnes n'ont pas suivi nos conseils. Donc, c'est une chose à voir. Donc, on va suivre ça de proche, mais c'est trop tôt à dire que le shutdown n'a pas fonctionné. Like I said, it's a bit too early to say that. People have been asking me again where these cases are coming from, and again, we'll just looking at our statistics now. We're just trying to get them out, but we will be publishing very shortly where they are. But I can tell you again, I would say close to 2/3 of the cases, about 60%, 65% of the cases are what we call close contact. Most of those are home contacts, living together with somebody who's positive, but we have in certain areas up to a quarter of those that are at work or through contact with a colleague and so on. So we're not seeing, this is not driven by outbreaks, this is driven really by contacts and close contacts. Donc, on se demande des fois d'où s'en viennent ces cas. Je peux vous dire que la plupart des cas, on a fait une analyse, on va le publier bientôt, c'est qu'on le trouve à peu près, je peux vous dire 2/3, 60% à peu près, qui sont des contacts proches. La plupart, les proches dans le domicile, ils demeurent ensemble. Vous pouvez voir, et on a pas mal des cas où on a une personne qui est positive et ça tombe qu'on a comme 5, 6 personnes dans le même foyer. Tous les 5 ou 6 deviennent positifs, donc on rajoute 6. Et si on a plusieurs familles, plusieurs foyers comme ça, vous voyez qu'on pourrait ajouter vite des cas 10, 20, 30, 40. Chose qui me soulage un peu, c'est que ces personnes-là sont déjà identifiées comme les risques et donc on les demande de s'isoler. Donc pendant la période d'isolation, ils sont positifs, mais ils n'ont pas exposé les autres gens. So what I'm seeing is with these cases that are these household contacts is that one of the reassuring things is that in most situations we identify the index case, the first case, and sometimes it's very hard to distance in a home, and so if they happen to have 6, 7 members in the home, all 6 of them are positive, and that adds another 6 cases from that one case. But we've isolated that individual because we've identified that individual as a close contact. So it doesn't mean, so we've kind of confined it. But again, we're looking at that. For the most part, these are not driven by outbreaks. Again, these are driven by these isolated cases. And again, about within that there's about a quarter of those that are workplace related. Again, staff to staff. Again, one of the major things that we're seeing, and I want to take some time to talk about it, is that individuals, they get together because they feel well. They don't have any symptoms and they say, oh, I'm fine. And they kind of let their guard down and they don't wear masks and they, have a party. And then a couple of days later, they get sick. And unbeknownst to them, they were contagious, 2 days before, not knowing they were contagious, and they spread it. That's called a pre-symptomatic spread, which is most cases, that's what we're seeing. Where they develop symptoms a couple of days later, but they feel well, so they go out and they don't, they don't take any precautions. So that's very important. Donc, au niveau, je voudrais juste souligner que qu'est-ce que nous avons constaté avec beaucoup de cas, c'est qu'il y a des gens qui ils semblent, ils n'ont pas de symptômes, ils se sentent bien, donc ils vont aller ils vont aller manger avec quelqu'un, ils vont aller visiter quelqu'un, ils vont pas porter les masques, ils vont pas faire la distance physique, etc. 1-2 jours après, il tombe malade et en effet, 2 jours avant qu'il tombe malade, il était avec quelqu'un, mais malgré qu'il n'y avait pas de symptômes, il était contagieux sans le savoir. Donc, on voit ça de façon pas mal fréquemment. Donc, c'est une chose à surveiller. Même si on sent bien, il n'y a rien qui peut prévenir que dans 1 jour ou 2 jours, on va tomber malade. Donc, c'est pour ça qu'il faut toujours respecter les précautions qu'on demande. In terms of the long-term care, I'm just going to go over. We have multiple long-term care facilities, but I would say that most of them don't have. It's not residents. It's 1 staff or 2 staff. The ones that have residents is the Akwesasne one, which has 9 positive cases and 1 death in a resident, and we have 9 positive staff. The Lancaster home long-term care, we've got 21 positive residents and 9 staff. And the rest of them that we have actually have no no residents that are positive except for Glen Stordon Lodge that have 2 positive residents and 3 positive staff. Those seem to be under control. Donc, on a une douzaine ou plus des maisons de longue durée et des maisons de retraite qui sont enflammées, mais la plupart ont aucun résident qui est positif. C'était plutôt le dépistage de routine que nous avons constaté qu'il y avait des employés qui étaient positifs. Donc, à ce moment-là, la maison de longue durée à Akwesasne, on a eu 9 résidents. Avec 9 employés qui étaient positifs, avec un décès dans cette maison. La maison de Lancaster, 21 résidents positifs, avec 9 employés. Et Glen Stordon Lodge, on a eu 2 cas positifs des résidents et 3 employés. Et les tests dorénavant, jusqu'à date, sont négatifs autrement. Et ça, c'est les seules maisons de longue durée qui, eux, on a eu des résultats positifs au niveau des résidents. Au niveau des écoles, nous avons 45 cas actifs. Bien sûr qu'on n'a pas, les écoles ne sont pas ouvertes encore, mais au niveau de nos chiffres, on a eu 45 cas actifs dans 31 écoles. In terms of our schools, we've had 45 active cases in 31 schools, and in total, we've had 57 cases in 31 schools. Donc, en total, on a eu 57 cas dans 31 écoles. Now, I just want to talk to you a bit about the vaccine. I know people have been asking me a lot of questions about the vaccine, and we have been itching to get our hands on some vaccine locally. As you know, there are 2 vaccines. There's the Pfizer vaccine and the Moderna vaccine. The Moderna has not really started being delivered in a routine basis, although the Pfizer has. So up until very recently, there have been some pilot projects, and I'm very happy to announce that as of next week, we will be receiving Pfizer vaccine in our health unit area that will be dedicated to vaccinating long-term care staff and essential visitors, and subsequently we'll be receiving another dose, another amount that will be vaccinating healthcare workers. That's the priority group that we're doing, following the provincial guidelines. We're also working with the ministry to get Akwesasne vaccines as well. So we will be receiving Pfizer vaccine next week. We'll be receiving 1 tray, which is about 1,200 dosages. We will initially be receiving it through Ottawa. It'll be sent to us from Ottawa. It will be a thawed out version, so we'll have about 5 days to use it. However, moving forward in subsequent deliveries, we will be receiving the Pfizer vaccine directly in Hawkesbury, where we have a minus 70 fridge in the Hawkesbury Hospital. And so we'll be able to manage it from there and distribute it. For the time being, what we're doing is we're working with our hospital partners to be able to offer vaccine sites, 5 vaccine sites in our area. We will be announcing the details shortly. We're just finalizing that right now. That will be exclusively for long-term care staff. We will then, they're also preparing for arrival of more vaccine for their healthcare workers in the hospitals as well. One of the things that we are anxious to do as well is we're just waiting for stability information of how we can transport the Pfizer vaccine, because we are going to start piloting it as well, hopefully in the next week or so, week or two, that we will be able to go into the long-term care homes and actually vaccinate the residents there as well, and any staff that haven't been vaccinated. So that is good news. So we will be getting vaccine effective next week. I'm not sure which day we're going to be rolling it out. It all depends on when we receive it, the thawing and so on. We're getting some information tomorrow about the logistics, and we're getting everything organized in that. Donc, au niveau de vaccins, je suis heureux d'annoncer que nous allons recevoir les vaccins dès la semaine prochaine. Nous allons recevoir une boîte de Pfizer qui est à peu près 1200 doses en dedans, et nous allons recevoir ça de façon hebdomadienne dorénavant. Nous allons le recevoir initialement de Ottawa, donc ça va être fondu. Donc, on aurait 5 jours à le distribuer et l'utiliser, mais on pourrait le faire. On est en train d'organiser 5 locales à travers de notre région exclusivement pour commencer à vacciner les employés de maisons de longue durée. Prochainement, nous allons recevoir d'autres vaccins pour commencer à vacciner les personnes qui travaillent dans les hôpitaux. En effet, aussi, nous sommes en attente après le 11 janvier, la semaine prochaine. Les prochaines livraisons vont être faites directement de Pfizer à Hawkesbury. Nous avons un congélateur dans l'hôpital à Hawkesbury qui est à moins 70. Et à ce moment-là, nous pourrons mieux contrôler la distribution et on aurait tout dans notre région. Donc, c'est juste exceptionnellement la première dose parce qu'il n'y avait pas le temps de changer le local de livraison avec Pfizer. Donc, j'ai hâte qu'on commence. On va commencer la semaine prochaine. On va avoir plus de détails vendredi ici. Demain, on a une rencontre avec le ministère aussi pour voir exactement les trucs opérationnels pratiques au niveau de comment on pourrait transporter, etc. Donc, ça va commencer la semaine prochaine. Et aussi, nous sommes dans l'attente aussi d'avoir la capacité bientôt de commencer à piloter le vaccin Pfizer, parce qu'apparemment, on pourrait le transporter maintenant, mais il faut suivre les directives de la compagnie. À un moment donné, on va commencer à vacciner les résidents des maisons de longue durée. J'ai hâte qu'on fasse ça. Et aussi, à un moment donné, on va recevoir le Moderna. Le Moderna va être plus facile à transporter. We're also going to be receiving the Moderna vaccine at some point, and that's going to be easier for us to ship. We have vaccines fridges both in Hawkesbury and in Cornwall for those as well. So we're ready to go. We're working with our partners. We're working with our hospitals. We are now so this phase one really is going to be a vulnerable and healthcare worker. So it's going to be the long-term care, retirement home, both residents and staff, healthcare workers, First Nations, as well as people living at home with home care, severe home care. That's going to be the first swath. That'll take us likely into the end of this month. Into early February. At that point in time, we'll be receiving more vaccine. And at that point in time, we're also going to be then looking at then extending it to frontline workers, extending it to elderly individuals outside of homes and so on. And then I believe that by March, we'll have ample supply, March, April, to do that. Right now, we're basing it on 2 vaccines, the Pfizer vaccine and the Moderna vaccine, but I'm also hearing that the AstraZeneca vaccine may be imminently approved as well. So that'll add to the vaccine numbers that we have. So that's good news, and we're waiting to go moving forward. Donc, au niveau des vaccins, ça sera, on va recevoir d'autres vaccins, on va recevoir le Moderna aussi, et nous avons les frigos pour ça aussi. Donc, à un moment donné, qu'est-ce que ça va faire? On va faire les priorités, la phase 1 qu'on appelle. Phase 1, c'est vraiment les maisons à longue durée, les maisons de retraite, les résidents et les employés et les visiteurs essentiels. Bien sûr, on va faire les hôpitaux, les travailleurs en santé, etc. Aussi, dans la même tranche, on aura les Autochtones au niveau de l'Akwesasne et aussi nous aurons les personnes qui demeurent à la maison qui ont besoin des soins à domicile importantes. Donc ça va être une tranche que moi, si tout va bien, on continue à recevoir les vaccins, on va être capable de finir tout ça d'ici fin janvier, début février. Et à ce moment-là, on aurait plus de vaccins et là, on va commencer à vacciner les gens en première ligne, non en santé. Et à ce moment-là, on va commencer avec des tranches d'âge 80 et plus, 70 et plus, etc. Donc, c'est à suivre. Donc, pour le moment, notre préoccupation est de vraiment viser sur les vulnérables. J'ai hâte d'être capable d'aller vacciner toutes les personnes dans les maisons à longue durée. The other question that I've had is that are we going to be holding back vaccines? At this point, we have been instructed that with the Pfizer, we're having adequate flow of delivery, that we will, when we get 1,000 doses, we're going to vaccinate 1,000 people. We're not going to vaccinate half to wait for the dose 21 days later. Apparently, there's now been established a reliable supply. Moving forward, however, for the first batch of deliveries for the Moderna one, we have been told that for that, we're going to be doing half and half, keeping it just to make sure that we have ample regular supply. Donc, au niveau, l'autre question que j'avais, c'est que est-ce que vous allez garder la moitié de dose pour la deuxième dose? Donc, la réponse est pour Pfizer, non, parce qu'on a établi maintenant une livraison de routine quotidienne, et à ce moment-là, c'est une source fiable pour nous. Donc, nous, maintenant, on se fait demander par le ministère de vacciner tout le monde. En effet, donc, si on reçoit 1000 vaccins, on va vacciner 1000 personnes. Par contre, au niveau de Moderna, au début, jusque le temps qu'on aurait la confiance que ça serait de routine, on recevrait nos vaccins de routine, à ce moment-là, peut-être avec Moderna, on va garder les moitiés, mais ça ne sera pas long. Je pense qu'avec Moderna, on sera dans des millions au niveau en canadien des doses, et en Ontario aussi, vraiment en mois de mars-avril. Donc, ça sera quelque chose de temporaire. Mais pour Pfizer, on ne va pas garder des doses les moitiés. So that's really the update that I've had for the vaccines. And again, this is moving very quickly. I was working over the holidays, even January 1st, speaking with the ministry to ensure that we were getting vaccine in our area. And so I was quite happy. Donc, ça, c'est vraiment une mise à jour dernière au niveau de nos vaccins, comment ça va dérouler dans notre région. Il faut dire aussi que le deuxième phase et troisième phase avec la public, ça va être un peu différent. On va vraiment avoir des cliniques à travers de notre région. On va avoir des mass immunization clinics aussi pour vacciner beaucoup de monde. Aussi, à un moment donné, on va avoir assez pour que ça soit distribué avec, au bureau de médecin, aux pharmacies, etc. So one of the things that I want to say as well, we're also having planning, as we move forward with vaccines and availabilities and so on, and we're moving sort of from the priority phase 1, phase 2, and so on, we're actually going to be planning, mass immunization clinics initially all over our area, obviously, and we'll then at one point there'll be what's called the equilibrium, where we'll be the vaccine will become available at family doctors' offices, pharmacies, etc., just like the flu shot. So I'm looking forward to that. I think that is a light at the end of the tunnel. What I'm asking is, is despite the fact that we do have a vaccine, we're not going to be able to, vaccinate enough people in a quick enough time to be able to say, okay, we don't need public health measures. We will need public health measures up until a certain time, probably not earlier than May or something like that. I'm just guessing. But again, so the message is yes, we have a light at the end of the tunnel. Be a bit more patient. We will start to get back our lives as we used to have them before the pandemic. Donc, dernier message, c'est plutôt de vraiment, on a le vaccin, c'est de bonnes nouvelles, mais d'ici quelques mois au moins, moi je dis avril, mai, juin, on n'aura pas vacciné assez de monde pour dire qu'il faut diminuer. On pourrait diminuer les restrictions. Même à ça, on pourrait avoir une diminution de restrictions progressives, mais on a jusqu'à nouvel ordre, jusqu'à on voit les chiffres, tout ça, on devrait continuer. So we need to continue our public health measures, and I don't think we're going to go from having, 50 people gatherings to 10,000 people gatherings. It's going to be progressive, but at least it's going to be a semblance of normalcy. And like I said, this is, the vaccine is marking the beginning of the end, but we're not at the end yet. So I'm going to go over some of the questions. I've actually answered a lot of them. J'ai répondu beaucoup de questions déjà avec ça. I've answered that. talking to me about talking about safe winter activities, saying that in Ottawa they've had some restrictions in ice rinks and stuff and overcrowding. We're paying attention to that. I haven't received anything locally in that regards. As you know, they are now asking masking to be worn outside within, I think, 15 meters of the skating rink. We have not done that yet in our area. Big box stores have a Section 22. We have been getting some complaints. We have visited them and ensuring that they actually are following those, and we've done that. Vaccine rollout, Christmas. Oh, the other question is, there's a question here about of the numbers of cases. Oh yeah, it's another one here. What are the Christmas pause? Ontario distribution of vaccines. Has anybody from the health unit traveled outside of our region? I don't think so. I haven't. In Ontario, thawed and thrown away. These are technical questions that Nation Valley asks about the vaccine. Usually, we try to use all vaccine, and we don't want it to go into room temperature for longer than it has to. So we try to do our best for using all the vaccine there. So that's a part of our planning that we're doing. We're calculating exactly, because now we go by appointments and we know exactly what would need. Is there a place where we have workplace-related outbreaks? No, we do not have them. We only have had a few since the beginning. Unlike Toronto has had, there's been 150 workplace outbreaks in Ontario, most of them GTA area, which is a different situation. When we do have cases where there's a small outbreak in an area, we actually go in. Sometimes we go in with the Ministry of Labor and look at the precautions and issue directives or corrections and so on. La droit ici, on se demande avec l'importante hausse des cas dans la région, est-ce que c'est juste à dire que l'Est d'Ontario retrouvera très probablement dans la zone rouge? On est déjà là, comme vous voyez. Et quand le confinement va terminer, on va rester où on est avec nos chiffres. Donc, si on est toujours en rouge, on va rester en rouge. Si on descend en orange, on va retomber en orange. I have another one, Toronto Public Health, detailed sector-specific workplace outbreak information. The reason I haven't done them is because we have very minimal compared to Toronto, so I haven't done those. So at this point, we don't have anything because it's not a concern to us. Radio-Canada nous constatons une hausse de plus de 250 dans quelques jours. D'une part, on explique cette augmentation comment. Je pense que je l'ai expliqué tantôt. Sébastien. Donc, on se demande, ici TFO me demande, avec les chiffres, ça m'inquiète. Oui, ça m'inquiète, mais comme je dis tantôt, on voit une stabilisation et on voit que la plupart sont des contacts déjà. Donc, ça, c'est une chose qui me soulage un peu, mais pas trop. De notre côté, comme j'ai dit tantôt, on va continuer à surveiller. I have another one here. Talked about the deaths. What is the number one complaint coming to the Eastern Ontario Health Unit since the lockdown began? I can tell you what it is, and it's a thorn in my side. That we're getting multiple complaints that big box stores are allowed to sell everything. And small retailers with clothing, for example, are not. And that is something that I've written to the ministry about. I've actually asked them to use what Quebec did. They allowed the big box stores to open, but only for groceries and essential pharmaceutical products. So I've asked that again, and I will send another memo again to the ministry requesting that because I think it's unfair that is going on. It's unfair to the small retail businesses. And I was hoping, and I had recommended in the beginning when they were talking about the lockdown, that we would follow the same as Quebec did, and unfortunately they have not. And so that is the complaint we're getting, and I must say I agree with that complaint. It's a valid complaint. Again, I asked about Toronto. Oh yes, the other question is I said that 10 to 15% of people are on the fence about vaccination. Yes, I want to clarify. I was part of a national think tank group a couple of years ago with Health Canada, and looking at vaccine hesitancy. And this was before COVID. And so what happened was we were looking at the percentage of people that are hesitant, and there's a definition. So there's a vaccine resistant, that they don't want vaccines at all. You can't change their minds. And we ascertained that about 10 to 15% of the population was vaccine hesitant. In other words, they had some questions, but if they got information from a trusted source like their healthcare provider, they were able to, oh yes, okay, now I understand. The questions were answered, and their sort of suspicions were relieved, and so on. And then they were able to be convinced to get vaccinated. So that's what I meant by the 10 to 15%, saying that those hesitant ones, that's why we need to provide information. We be transparent about this, the vaccines, and so on. And again, we're not gonna, we're not forcing people to get vaccinated, but we're trying to convince them with evidence and so on. So that's what we mean by vaccine hesitancy, and how you approach that. Approaching it by just screaming at people and forcing them to vaccinate will not achieve any good. So that's what I meant by vaccine hesitancy. And that's about it. So I will. It's been longer than usual, but I had a lot to say. Donc, je vais ouvrir aux questions.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchet, the leader. Please go ahead.
Good afternoon, Dr. Paul. Happy New Year.
Same to you, Philip.
So 2 questions. The first one, on the outbreak section of the health unit website, says community living Dundas, Winchester has an unknown respiratory outbreak. Are you testing for COVID? And if so, how many people?
Yes, we do. What we do is when we do get an outbreak like that, we test the cohorts around, and if it's positive, then we test everybody.
Okay, so how many people approximately?
I don't know. I don't know how many we've tested. I haven't seen the details of that one.
Okay, and second question is about school. Right now, kids are e-learning again, and the elementary students are slated to go back next week. Do you think it's wise for the elementary students to go back on Monday with the numbers in this region going up?
That is something that I've been actually thinking about. We actually discussed that today at the ministry level, looking at the pros and cons of going back to school, and the pros and cons of from the point of view of infection prevention and numbers, and the pros and cons of it's kids need school and so on. I'll be honest with you, I'm kind of right at the middle of it now. I'm not too keen on closing the schools longer, but I'm not saying that we shouldn't close them. And the reason I'm saying that is because we've aside from some of the first of all, I want to say that the schools are not the sources of infection. However, they do increase more traffic back and forth, people going out, etc. And what we've noticed, and if we have a high level of community transmission, we've had actually a couple of schools close, not because there was an outbreak in the school. It's because there were so many people that were in contact with, so many staff that were in contact with the initial case that was positive from the community, that they couldn't operate the school. So if you're going to open the schools and get that, then you may as well close them. So I'm actually right sort of borderline with that, looking at the numbers. I think as we see trends, we can make better decisions. Can there be a regional approach to that? Yes, but I'm not sure at this point.
Yeah, because the secondary students aren't going back until the 25th.
Exactly.
Scheduled, and that gives a full month.
Yeah.
2 full cycles for infection to come through too. So
exactly. And so what happens now, we're giving them 1 cycle by the end of the week. And so I think if there's going to be any decision, it should be made sooner rather than later, because you are approaching next week.
Okay. Thank you very much, Dr. Paul.
You're welcome.
Our next question comes from Nation Valley News, who asks, will the lockdown persist beyond January 23rd?
That's a very good question. It all depends on the numbers. It depends on where we go with the numbers. That's why I think the next, I would say, 7 to 10 days are pivotal. They're going to tell us, they're going to be kind of a reflection of what happened on Christmas and moving forward, what happened in New Year's, and to evaluate the extent. If we see a blunting and a decrease in the numbers, I think that there will be some loosening of the restrictions. But I fear, on the other hand, if we start getting numbers that are increasing or not moving, perhaps there might be an extension of the lockdown. Again, I can't say, but those are the possibilities on the table.
And when do you expect long-term care and medical staff vaccinations to conclude?
If all goes well and I get my vaccine supply within this month.
Thank you. Next question, Giacomo Panico, CBC. Please go ahead.
Yes, hello and Happy New Year, Doctor.
Thank you.
Just wondering, you talked about how it's not linked to the surge in new cases to outbreaks, that it's more from households. But how do we have information on how it's getting into the household in the first place? Is it from people out in the community or people mixing households?
I think that's what it is. It's both. It's a combination of both. And what happens is we know that if you look at and we'll have a Venn diagram out in a couple of days but if you sort of picture it in your mind, if you look at sort of the Venn diagram, you look at around 2/3 of it being what we call close contacts. Within that, you get a swath of associates and sort of colleagues. So that's friends, and that's about probably 20% in there. And then another quarter of that is at workplace. So you can see how those two will feed the close contact. So if, for example, one person that contracts it at work or going to another household and then comes home and then infects, 5 or 6 people in home. So you can see how that goes. That's what we're actually seeing.
Thank you very much.
You're welcome.
Next question comes from Jordan Howarth, Standard Freeholder. What long-term care homes are you hoping to receive the vaccines first? Hawkesbury, Cornwall?
We're going to look at we're going to be trying to be as equitable as possible, and we're going to be looking at a risk-based analysis. I'd like to start everything, at the same time. If we don't have enough vaccine going around, we're going to have to prioritize. We have risk stratifications, and we're going to go by risks, and we're going to be working with the Ministry of Long-Term Care to determine that. But I'm hoping that we'll be able to get a big swath to be able to vaccinate and start vaccinating different regions at the same time.
Thank you. Next question, Nick Seabrook, Cornwall Seaway News. Please go ahead.
Hi, Dr. Paul.
Hi, Nick.
My question is that out of the new cases that we saw in the region, are any of them the result of the UK variant, the hyper-infectious one?
Good question. That was a question I forgot to answer. It was actually on my sheet here, and I forgot to answer it. No, so far, no. How do I know that? Is because the laboratory does the actual RNA testing and would actually flag it.
All right, thank you.
You're welcome.
Prochaine question, Samuel Blais-Gauthier, Radio-Canada, c'est à vous.
Bonjour, Dr Paul.
Bonjour.
Donc, tout à l'heure, donc selon nos données, là, on parle du 31 décembre, on avait 1423 cas et donc aujourd'hui, on parle de 1730. Je sais que vous en avez parlé, mais pour le bien de la télé et de la radio, est-ce que vous pourriez expliquer en vos mots, en quelques phrases, comment on peut expliquer une hausse semblable?
C'est parce que nous voyons plutôt les cas, la plupart des cas qu'on voit, c'est vraiment le contact de proche, soit un contact dans la maison, mais on a un pourcentage important qui ont atténué avec un confrère ou un ami en dehors de la maison. Et ceci, à peu près, c'est 30%, les deux ensemble. Et à un moment donné, ils rentrent à la maison et cette personne va infecter les personnes dans le foyer. Donc, c'est comme ça qu'on le voit parce qu'on n'a pas beaucoup de flambées qui peut expliquer cette augmentation. Donc, vraiment, on voit les gens soit qui vont en faire l'acquisition au travail ou soit qui vont faire l'acquisition avec un ami ou une visite, etc. Et à ce moment-là, ils vont rentrer à la maison et ça va multiplier les cas parce qu'une personne dans la maison qui a 5, 6 personnes, voilà, on a 5 cas. Donc, ça multiplie très vite. Donc, si on a 4, 5, 6 familles comme ça, voilà une trentaine de cas.
Donc, on explique ça vraiment là, par la transmission communautaire.
Oui, mais connu, pas non connu. On peut l'identifier.
Merci beaucoup.
Pas de problème.
Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Do those joining by phone have questions? Press star 6 to unmute.
Yes, Stéphane Bourgeois from the Régional Hawkesbury. I was wondering if the Pfizer vaccine will be received at the long-term care if the entire, let's say Prescott-Russell residents, workers will receive the Pfizer vaccine once. Is it one dose or two doses?
It's 2 doses. Both the Pfizer vaccine and the Moderna vaccine are 2 doses. The new vaccine that might be approved shortly, the AstraZeneca, is 2 doses. There's another one from Janssen that's 1 dose, but those are not available yet. So both vaccines that are available are 2 doses. The Pfizer vaccine is 21 days between. The Moderna vaccine is 28 days between. So depending what we use, there might be a different waiting period between the two.
Okay. You won't mix Pfizer with Moderna?
No, you cannot. You cannot mix them. They're not interchangeable.
Okay. And positivity, le pourcentage de positivité communautaire en ce moment aujourd'hui?
En effet provincial, c'était 7,2. Nous, on est rendu presque à 3 à 4. Je ne suis pas sûr, mais on n'est pas à 7. Mais de façon provinciale, c'est 7,2 ce matin. Nous, je pense qu'on est rendu à 3 à 4 %.
OK, 3 ou 4
Oui.
Sinon, provincial, 7,2.
7,2, oui.
Merci.
Pas de problème.
D'autres questions par téléphone? Other questions by phone? Seems as though those are all the questions for today, Dr. Paul.
Thank you very much, everyone. Merci beaucoup, tout le monde.
Merci.